Then we have Hodgkin's lymphoma. We're just doing about non-Hodgkin's lymphoma. So in this case, we're talking about Hodgkin's lymphoma. So this is less common. If you compare non-Hodgkin's and Hodgkin's lymphoma, the Hodgkin's lymphoma is less common and may be localized to a single nodal group. So it may be just localized in one nodal group. For example, it may be affecting maybe cervical lymph node, other than lymph nodes in the cervical region. It may be affecting lymph nodes only in the inguinal region or the axillary region, wherever else. So it may be localized to a single nodal group. So the spread of Hodgkin's lymphoma is predictable, usually by involving contiguous nodal groups. So basically, when we talk of contiguous, it means nodes that are close to one another, that are neighboring this node. So they will move from these nodes to the immediate neighboring nodes and so on. So basically, that's what we mean by contiguous nodal groups. And with dissemination to the liver, spleen, and bone marrow only late disease. So most of the time, the Hodgkin's lymphoma will be found localized, mostly to a great extent. And its spread is predictable because it will move from those lymph nodes that are affected. So mostly they will tend to affect the nodes, lymph nodes. That's why we talk about extranodal involvement is uncommon. And earlier stages can often be treated effectively by localized irradiation of the affected nodal group. So early stages, if you find them in early stage where it's affecting only one group of nodes in one place, you can just treat it by irradiation. That is basically radiotherapy. You just focus on your radiation around those lymph nodes that are affected. So early stages. So if you have to find it in early stage, you can just treat it by localized irradiation. That is basically radiation, radiotherapy, applying radiation into that particular area only. So almost always present with painless enlargement of lymph nodes throughout the body. So in this case, you have also the painless lymphadenopathy throughout the body. And they are malignant also, just like non-Hodgkin's lymphoma. There are lymphomas. If you have lymphoma, it's always malignant. And the cause is unknown. And it is more common in males than females. And you can see the highest incidence. That is when they are most of the time diagnosed. There are two incidents that are highest, between 20 and 35 years and between 50 and 70 years. So those are the places mostly where they will be diagnosed at those two ages, 20 to 35 years and 50 to 70 years. And this one leads to reduced immunity because lymphocyte function is depressed. So the functions of lymphocytes are depressed. And so there will be recurrent infection will be common. So there will be a lot of infection because immunity generally will be low. Yeah, so the functions of these lymphocytes will be depressed or decreased. So they tend to be recurrent infection. So anemia and changes in leukocyte numbers occur if the bone marrow is involved. So if bone marrow is involved, because what usually does is these lymphocytes proliferate and then they crowd out everything else. So they prevent the production of other cells, red blood cells among others. And so you may end up with anemia, low hemoglobin level, because less red blood cells are produced. Because basically, there may be growth of lymphocytes if it is affecting the bone marrow. So they crowd out everything else. And so you end up mostly just producing lymphocytes at the expense of the other. So you may end up with anemia and also changes in leukocyte number. So you may end up have low number of neutrophils, for example, or the other white blood cells. And then you have excessive lymphocytes. So it is rare for the disease to spread to non-lymphoid tissues or organs, as I've already said. Yeah, so to non-lymphoid, it rarely spread to non-lymphoid. So it will spread to those lymphoid tissues, the spleen, the thymus, maybe, and the bone marrow. It can also spread there, but it's rare that it will spread to other organs that are non-lymphoid tissues or organs. And then, of course, there we have just a diagram showing the different forms of non-Hodgkin's disease. So, of course, if you go to this Hodgkin's and Hodgkin, there's a lot more details, but which I thought at your level now may not be so important. So there are even classifications, very many classifications that will be there in the books. But I think service to know that we have different forms of non-Hodgkin's disease. For example, we have lymphocyte predominant. That means there are a lot of lymphocytes. As you can see, there is a lot of proliferating lymphocytes. So lymphoid sites are a lot in lymphocyte predominant type. And then, of course, you can see Reed-Sternberg, RS cells, Reed-Sternberg cells. We have the one we call polypoid. In the second, in the nodular sclerosing type. So there is formation of nodules. As you can see there are bands of collagen forming nodules. That's why it's called nodular sclerosing type. And then the type of Reed-Sternberg cell that we find there mostly will be called lacunar Reed-Sternberg cell. And then we have one we call mixed cellularity. That means there are different types of cells. So you have maybe B lymphocyte, T lymphocyte. We have many, many types of cells within it. So mixed type. For example, there you can see plasma cells, mostly B cells. We have eosinophils, we have neutrophils. So it's a mixture. And we have the classic Reed-Sternberg cells that is found in that type, mixed cellularity. And then we have one that is lymphocyte-depleted. So here the lymphocytes are it's depleted. So we have very few lymphocytes. So we have depleted lymphoid cells and so on. So that is the type we'll call. And then we have a type of Reed-Sternberg cell we call pleomorphic Reed-Sternberg cell. So we have those types. So I wouldn't want you to go into a lot of detail, but as you move on in your as you go to the clinical areas, I know you'll find lymphomas. You can read more, just to know that there are many types, but I did not think that you needed to go into all those details at this stage. So this, whatever I give you, probably will be enough.